Hey guys, this is Dr. Herb. In case you haven't subscribed, please do subscribe for updates. Fincham test. So this Fincham test, it is aka the Emsley-Fincham test. So it is also known as the Emsley-Fincham test. Now what are the important features of this? The main purpose of this is to differentiate between the colored halos due to the cataract and the colored halos due to, in case of the corneal edema due to glaucoma. So it is for the color halos to differentiate the cataract and the glaucoma. Next is the halos are broken into segments which resolve as a slit moves. So the halos it moves, they appear broken as there is movement, and the halos are broken into segments which resolve as the slit moves. So when they move this, so they resolve when the slit moves. On movement, it resolves. Next is, in this case, it is known as the lenticular halo. Then comes the intact halos. So in terms of intact halos, the intensity and the brightness, they are diminished. The intensity and the brightness, if you see it, decreases. And this is the glaucomatous halo due to the fluid accumulation in the corneal epithelium. So intact halos are found in the glaucomatous. So it is seen in case of the glaucomatous halo, and this is nothing but due to the fluid accumulation in the corneal epithelium. So in corneal epithelium there is a fluid which is accumulated. Next important thing we need to know is about the stenopic slit. So the use of the stenopic slit. So what is the use of the stenopic slit? So this causes a reduction in size of the blood circle. So reduced size of blood circle. So it reduces the size of the blood circle, and this is in the meridian perpendicular to the slit. So this is with the meridian which is perpendicular to the slit. Next is, there is no change in the blur circle. So there is no change in the blur circle, and this is in the meridian coincident with it. There is no change in the blur circle with the meridian coincident to it. Next, they are used to determine the axis of the cylinder in astigmatism. So it is used to determine the axis of the cylinder. So determine the axis of the cylinder. This is in case of the astigmatism. Next is, in cases of corneal opacity, the site for the optical iridectomy is determined using the stenopic slit. So it is used in case of the corneal opacity as well. This is for the optimal site for optical iridectomy, to find the optical site for the optical iridectomy. To learn and grow daily like this, please do subscribe.